Good afternoon, friends. And I'm Dr. Deepak Agarwal, and who is currently practicing at ARH Diabetes Center, Guwahati, and which is a unit of Dr. A. Ramachandran's Diabetes Hospital. And today I'll be talking about self monitoring of blood glucose, and the word itself is self-explanatory. That means you have to monitor the blood glucose at home without the help of any third party, and thereby you can delay the microvascular and macrovascular complications. So all this I'll be explaining and in details about that SMBG, self monitoring of blood glucose. So let me tell you, so diabetes is a lifetime disease. So once diabetic, you are always a diabetic, and till date there is no cure for diabetes. So, and it has been seen in the landmark trials like UKPDS that if you are not controlling your diabetes, it can lead to many complications. It can affect almost all your organs of your body, including kidneys, nerve, eyes, heart, and everything. So, and thereby it becomes very important to control the blood glucose and keep it in the minimum range which is given to you, so that these complications can be delayed to the max, so that even if this complications comes to you, this does not affect your productive years. So the basic aim of treating diabetes is to delay the complications so that it can preserve your productive years. And even if you get the complications in the later years, like once you are 70 plus or 80 plus, it does not affect your productive years. So how can you control your blood sugars? So we do have the parameters like uh, HbA1c, which is the glycosylated hemoglobin, which tells you about the average blood glucose of the last 2 to 3 months. Then you have the parameters like SMBG, which is the topic of discussion today, and the latest advanced technology has also given us CGMS, which is the continuous glucose monitoring, but which is very much being done in US and UK, but not that much very popular in a country in a developing country like India. So there are differences between SMBG, HbA1c, and CGMS. So mind you that SMBG is not an alternative to HbA1c. It's just a complementary to HbA1c. And SMBG is a cost-effective manner because CGMS again is an invasive procedure and it costs you a lot of money. And SMBJ does not cost you anything. It is very easy to learn and it is very easy to monitor. You can do it at home. You don't need any third party assistance, and it tells you almost everything about your blood glucose values. And so how to do it and all that will be discussed now. So the benefits of SMBG are many. First of all, it gives you a live glucose value. Suppose it gives you the immediate feedback. What is your blood glucose levels at this time of the time? So if it can tell you, it can detect undetected hypoglycemia. It can tell you whether your glucose are high, whether it is in range or it is really very high, so that it can lead to complications like diabetic ketoacidosis. So, and all this helps in deciding the type and dose of medicines by the healthcare physicians. So, and again, and if we can with that, if we can manage to bring the sugars under control, that can always delay the complications. And that is why the benefits of SMBG are many. And it is almost known to every diabetic patient that they should do SMBG at home. Now, how many times you should do it? You can there is no black and white regarding that. You can do it as many times as possible, but at the same time, it should not affect your day-to-day life. You can check 3 times, you can check 4 times, you can even go for 8 times checking. So, but in some particular situations like the type of diabetes, like the type 1 diabetes, gestational diabetes, so there you know that the type 1 diabetes is an insulin dependent diabetes. So, and in that case, and you have to go for more frequent monitoring of the blood glucose, like you have sometimes have to go for 7 point monitoring, like the fasting blood glucose before breakfast, after breakfast, before lunch, after lunch, before dinner, after dinner, and sometimes 3 a.m. in the midnight. So, and again, in cases of this the gestational diabetes, that means that the diabetes which the pregnant ladies get during the pregnancy stage. So in those cases also, and it becomes very important to go with the SMBG values, because the HbA1c is not very much reliable. In fact, the SMBG is the golden rule for pregnant women. And again, those patients who are on sulfonylureas and who are on insulin, so we know that the sulfonylureas and insulin can cause hypoglycemia. And again, hypoglycemia is an emergency condition. So in order to detect all those undetected as well as predicted hypoglycemia, so those cases also you have to go with the SMBG. Again, many things are there, like you can regarding the dosing can be adjusted, the dose of the medicines can be adjusted, and you can adjust your insulin dose also. You can decrease the dose of your tablets with the help of the SMBG readings. So help SMBG readings gives you a lot of information about your type 2 diabetes, as well as your diabetic status, and in fact it can complement the HbA1c values. You can tell whether the HbA1c value which you are getting in the lab is really matching with the SMBG values or not. So that can also we can get it through the SMBG values, through these SMBG values. So the SMBG is very useful. And I practice in a place like Guwahati, which is in the northeast India. And here we get a lot of hemoglobin variants. And we know that this whenever you have this hemoglobin variants, you cannot do HbA1c, because the HbA1c is done through high HPLC method, and this HbA1c values you cannot get when you have an hemoglobin variant. So in those cases also, this SMBG readings are very important. Again, we are living in a poor country like India, where this anemia is very prominent. And since this HbA1c depends on the hemoglobin values, you can get the false high or false below readings in case of these anemia cases. So in those cases where there is limitations of HbA1c, you can always go ahead with the SMBG values. So the SMBG readings are very important, and every diabetic patients have to learn what is SMBG, how to do it, and how to read those values, and how to manage all these cases. So SMBG, and that is why we are here on Facebook live session to discuss about SMBG, and in case to discuss, and if you have any queries, we can take it at the end. And you know that SMBG, and now I've told you that it is needed for every diabetic patients, but for this SMBG you need a glucometer. So now many patients ask me, sir, which glucometer I should buy. So in that case, you have to go with the glucometer which complies to the 2013 standard norms. So so the standard norms are that the lab results which you are getting in the laboratory should matches with the glucometer readings. And so what are those standard norms is there? So the 2013 standard norm says that, so if your lab results are within 100, suppose if your lab value of blood glucose is less than 100, and if the SMBG readings gives you the value in between 85 to 115, then that means that the glucometer is correct in that case. Again, if your lab values, in case your lab values glucose readings are above 100, suppose if it is 200, and if the glucometer readings 20% plus minus, suppose if the glucometer readings gives you a reading of 180, in between 180 to 220, then also in that case we call it as the glucometer readings are at par with the lab results. These variations are because in glucometer we are taking a capillary blood, and whereas in case of uh, uh, whereas in case of lab results you are collecting a venous blood, so you know that the venous blood, the since the glucose is being utilized by the muscles and the subcutaneous tissue, so you tend to get lesser values in case of venous blood than the capillary bloods. But you have now many modern glucometers in the market in which the values are calibrated at par with the venous blood, so you don't have to do any plus minus in case of glucometer readings, because the newer glucometers which complies to the 2013 standard norms are calibrated. So I always tells that there is no this capillary blood values which you are getting in the glucometer readings are at par with the venous blood, because those are the calibrated glucometers, and you don't have to do any plus and minus. So so you can almost get the similar results which you are getting in the labs with the glucometer readings. But there are some norms like the strips. The strips you have to be very clear about the strips, because this glucometer strips are very sensitive. You have to see that those glucometer strips are not expired, because they come with an expiry date not more than a year. And you have to see that once you open that cartridge bottle of the strips, you have to it does not get exposed to the sunlight very often. So as soon as you take out one strip from the bottle, you just close the bottle immediately, so that the sunlight exposure is not there. You have to keep the strips dry. You should not, and you have to see that you cannot change the container of the strips from one container to another. That also you need to see. So the and expiry, you have to store it in a proper storage conditions. Again, you have to use a proper glucometer. Again, I tell you, these glucometers now are now have a modern technology. So these are updated glucometers. You have the memory in them, so the whatever glucometer readings that you are getting, it automatically gets saved in the glucometer. And some of the glucometers have also inbuilt Bluetooth in them, through which this inbuilt Bluetooth, you can transfer all your glucometer readings to an iPhone, and thereby you can transfer all these readings to the cloud system also. So that all these readings get stored in a proper software, and whenever you need this data, you can always generate this data. So the newer glucometers helps in generating more and more number of data, so that whenever you need that data, you can get it through the cloud system or through your smartphones. So I always tell my patients to buy a glucometer which has a memory in it, which has a Bluetooth in it, which you can connect it to your smartphone, where the readings you can save it in the cloud system. And this readings, so whenever this pattern analysis of the SMBG readings needs to be done, so the healthcare professionals can always see those readings and then analyze what is being wrong, where these tablets needs to be modified, whether the dose of the medicine needs to be brought down, or it has to be brought or whether you need to increase the dose of the medicines. Suppose if the patient is on basal bolus or is on basal regimen, suppose if the patient is on glargine insulin, and if you do not know, and if you get an high A1C value, high glycosylated hemoglobin values, and in that case you just suspect that there might be an hyperglycemia. This can be after breakfast, this can be after lunch, or this can be after dinner, but you are not very sure about it, and you want to add a prandial insulin to it, but you are not sure whether you have to add it before breakfast, or you have to add it after lunch, or you have to add it before dinner. So in that case, if you have this SMBG readings, that will clearly tells you whether you need to add the prandial insulin before breakfast or before lunch or before dinner, so that prandial peak can be controlled, and thereby you can control the HbA1c values. So all this can be done only true when you have this SMBG readings, and when you know how to check this do this SMBG, and when you have a clear data out of this SMBG, and when the doctor can make a clear sense of this SMBG readings, and then only you can, this titrate your titrate the dose of the medicines or the insulins, and thereby you can keep your maximum blood sugar levels in the target range. So now the newer things which is coming up right now is the CGMS, which is the continuous glucose monitoring, which says that all your target values, that means the blood sugar values in between 80 to 180 should be almost like more than 70% of the values should be in the target range, and less than 4% values should be below the target range, and not more than 30% values should be above the target range. So all this can be done only to the SMBG readings and CGMS, so the dose adjustments can only be done when you have a proper readings of your blood glucose either through SMBG or through CGMS. So this is about the CGMS, and I've told you about the hemoglobin variance. So when you have this hemoglobin variance, when you have this anemia, where this A1C cannot be done, you have to be dependent on SMBG. And then again, regarding this glucometer can generate a lot of data, and you can save this data in the cloud system, and thereby you can analyze this data, and thereby it can tell you a lot of things about your diabetic status. And suppose if the patients, suppose if you see a readings of a week's value of this patient, SMBG readings, and suppose, and that can also tell you which the patient sometimes forget to discuss with you in the clinic. Suppose if the patient fasts on Monday, every Monday or every Friday, and if he forgets to tell you in the clinic because of the paucity of time, so those things which the patient forgets to tell you in the clinic, you can easily come to know to the SMBG readings, because when you see these SMBG readings, you will come to know that this the patient is going into hypoglycemia during whenever he goes for fasting either on Monday or Friday. And in that case, you can always ask the patient to not to take the medicine or to decrease the dose of the insulin during those fasting days. And suppose if the patient is a busy schedule patient, if he's a busy executive, and if there are no timings for the blood for this diet patterns and all that, so in that case also this SMBG can tell you can tell you a lot of things in these busy executives about so how to manage the OHs as well as this insulin therapy in those busy executives. Again, tell you that these diabetic patients also have many comorbidities like hypertension, dyslipidemia, and sometimes and finally they'll end up into chronic kidney disease. So in those chronic kidney cases, again the hypoglycemia is a very big risk. So in those patients, elderly CKD patients, you have to go ahead with the SMBG readings, and you can again where you have to titrate the insulin even up to zero point 0.5 unit also, so that you can delay the complications further. And in GDM cases, this gestational type diabetes mellitus, where you have to target the blood glucose levels below 120. The targets are very stringent in the gestational diabetes mellitus, because it is seen that even a slight elevation in the blood glucose values can affect the fetus, and thereby it can lead to many congenital anomalies in the fetus. So in cases of gestational diabetes, you have to target very tight very tight control of the blood glucose, and which can only be done through SMBG readings. And you have to, in gestational diabetes, I ask my patient to do at least 4 readings in a day, 1 fasting or 3 postprandial, or if the fasting is high, at least 3 fasting values and 1 postprandial values. And the patient is not very motivated enough to do enough of this SMBG, maybe because of many other reasons. So in that cases, I ask them to do at least two readings in a day, so that at least you will have some idea. But those two readings should not be at the same time all the days. So what you can do is that you can ask your patients, one day you can ask them to do before breakfast, after breakfast. Another day they can do it before lunch, after lunch. And some other day they can do it before dinner, after dinner. And sometimes they can do it at 3 a.m. values. And whenever there is a risk of hypoglycemia, so random checking can also they do. But the main target is that you have to keep the blood sugars in range, and you have to do enough of blood sugar this monitoring, so that whenever it goes out of control, and you can immediately take an action and bring it under control. So that is the main purpose of SMBG, and it tells you a lot of things. And every diabetic patient should do this SMBG with a good glucometer, which has a memory in it, which can be connected to the smartphones, and which gives you an accurate reading, and which are calibrated. And now the glucometer size has also gone down. It is a very small device. You can keep it in your pocket. You can do it as whenever you want. So it's just the size of a pager. And the strip price has also come down. Now it costs around 10 to 20 rupees only. And the glucometer itself, a very smart glucometer itself, can cost you around 1500 rupees. So the prices of glucometer as well as the strips have gone down. And it has become now very easy for the patients to do this SMBG readings with the help of this glucometer. And with this SMBG readings, they can come to know a lot of things about their glycemic status, and thereby they can take the steps either themselves or through the help of the healthcare professionals. And in that case they can adjust the therapy, be it tablet or insulin, and thereby they can take the immediate step. So, and in that case, this just 1500 rupees of glucometer, in fact, is very economical, because what I mean to say is that the treating complications are very expensive. Even one hypoglycemia, if you get treated in a hospital setup, will cost you a lot of money. And the complications like the CKD itself is a very expensive affair. So you have to prevent all this, and that can only be done if you are a regular user of SMBG, and if you know how to avoid this hypoglycemia, and if you know how to keep the blood sugars in range, so that this complications does not come early. So, and that is why this SMBG is a must for every type 2 diabetes, for every diabetic patient, in fact. And you have to do it very frequently. But it should not at the same time, it should not be like that it affects your day-to-day life. So it should be flexible according to the patient. So you should see that the patient does not, follow your instructions very nicely, whatever you say to them. That means if you ask the patient to do the structured SMBG, and so they should follow it. Suppose if you ask them to do 7 times, and if they are not doing it even 1 time, so there is no meaning telling them to do 7 times SMBG reading. So what you can do is that you can discuss with them. So you can just tell them, okay, I understand your daily schedule. So yeah, you can do it at least 2 times, or you can do it at least once weekly. And so you can customize the SMBG checkings according to the patient's health status. Suppose if the patient is on metformin, and since we know that the metformin is a sensitizer and it does not cause hypoglycemia, so in those cases, if the patient is on metformin only, you don't have to go with the frequent SMBG readings, because there is no as such the risk of hypoglycemia with metformin. But if the patient is on secretagogues like the sulfonylureas, if the patient is on heavy dose of insulin, if the patient is already a CKD patient, if the patient is a gestational type 2 gestational diabetes mellitus patient, if the patient is type 1 diabetic patients, where you have to go with the tight control of the blood sugars. So in that cases, you have to go with as many times checking of the blood sugars with this glucometer. And you have to note down either in a notebook or it might get automatically get the readings get locked in the glucometers, and thereby gets transferred to the smartphone through these Bluetooth devices and all that, and thereby and it can reach the healthcare professionals, so that the healthcare professionals can see the readings live and then decide about the dose as well as the type of medicines, and regarding whether you need to add the pendal insulin or whether you need to make changes to the diet, whether the patient is doing enough of physical activity also, or whether the patient is real going into hypoglycemia. So all this information can be accumulated only through these SMBG readings, which is a very cost effective procedure for type 2 diabetic patients, because the cost of glucometers have come down, the cost of the strips have come down, and thereby you can help your physician as well as yourself in preventing the complications, and thereby keeping your sugars under control. So, and that is in brief about the SMBG readings. So, friends, it has been a pleasant talking to you. Thank you so much for listening to me. And if there are any questions from the viewers, uh, I'm ready to answer. Thank you, everyone, and thank you. So I'll wait for just 30 seconds, and then I'll just close it down. So, friends, thank you so much for listening to me. Stay safe, stay healthy. Bye bye.